Okay, folks, we're going to go ahead and get started. Ready? All right, so I'm going to introduce you Dr. Cate Jones-Hazledine from Rushville, Nebraska. Just a little brief about Dr. Cate. She operates 8 clinics in western Nebraska. She's a licensed professional healthcare provider. I don't know that I need to go into long detail. I'll let her go into her talk and tell you about. She's doing a lot of things throughout the state besides just operating those clinics as far as advocacy and other things. But she's an advocate for agriculture. So,
thank you, sir. Hello, everyone. Thanks for coming right after lunch. I appreciate you being here. As Ryan said, my name is Dr. Cate Jones-Hazledine. Folks out where I live tend to call me Dr. Cate because the last name is too long for most of the kids I work with to remember. So mostly I'm Dr. Cate out there. Let me tell you just a little bit about myself, a little more than Ryan shared. I am a rural Nebraskan, kind of born and bred, several generations lived in Nebraska. I have an ag background, but not to the extent that most of you folks do. So I spent my early years on a farm in central Nebraska near Sumner, Nebraska. I don't know if anybody knows where that is. I see a couple of nods, so that's incredible because Sumner's probably 150 people on a good day, isn't it? And my brother, his family do ranching now. I mostly stick with the mental health gig, but because of where I'm located, the ag community is a big part of the work that we do and a big part of my passion for mental health. Currently, I'm a clinical psychologist and I also own Western Nebraska Behavioral Health Clinics. And as Ryan mentioned, we cover or try to cover most of the Panhandle and the Sandhills area of the state of Nebraska, which is, I don't know, about like 17,000 square miles or something out there. So we have 8 different sites that we travel to. We have a team. We travel to different sites kind of every day of the week to try to provide at least some level of care in those almost entirely agricultural rural communities. So in addition to that, I'm the co-director of what's called Beacon Panhandle. And Beacon is the Behavioral Health Education Center of Nebraska. It's an organization that's been going on for about 10, 12 years now, but they just carved out the Panhandle version of it a couple of years ago, recognizing that the needs at that end of the state were very different from the rest of the state. So in that capacity, we do a lot of work with recruitment and retention of behavioral health providers, which is a huge problem, as we'll talk about. When we start talking about rural mental health and how to get people in the door, we have to have providers there once they get in the door, right? And that's, in most of our areas, a large problem. So this is the area where I live. This is just south of my house. This is called the Sandhills. It's a beautiful area, especially if you like sky, because there's not a lot of variability in the land itself, but the sky puts up quite a show. So these are where our clinics are currently located, spread out. As you can see, Nebraska is a pretty large state, and this is the only part of the state of Nebraska that's not considered an underserved area by federal guidelines in terms of mental health providers. So 88 out of 93 counties, I think, are currently considered to not have enough of any kind of mental health providers, psychologists, psychiatrists, counselors, anything. So we're attempting to make some inroads, and in the meantime, we're doing our best to cover services where you see a star. Most of our sites are what's called integrated care sites. I don't know, do any of you know much about integrated mental health? Jason does. So in integrated care is the idea that we're going to house different kinds of health care together in order to kind of give a better bang for our buck to the consumer, as well as to break down some of the ideas of stigma and, lack of confidentiality or lack of anonymity that hold people up. So our clinics are largely housed within other medical settings. So on Tuesdays, for example, I provide services at a Shadron Medical Clinic. And I walk in the door, and the med assistants tell me what hallway is not being used that day. And that's where we provide our mental health care. So it's right within the primary care clinic, which has a number of advantages that we'll talk about, especially with a rural population, especially with an underserved population, as we'll talk about in just a minute. So today I wanted to kind of focus in on a few things. Jason will be talking about mental health from a different perspective, and so I wanted to kind of keep my lane fairly narrow. I want to talk about kind of the state of mental health from a provider side that we see in farming and ranching communities now, the reasons why there are such high rates of mental health related issues within the populations that I work in, some of the obstacles to care, and then I want to wind up talking about ways that we're trying to kind of think outside the fence lines, think outside the box a little bit, and get creative in what we're doing to help serve these communities better, because I think that's the key, that we can't just keep doing the same thing. What's that they say, that the definition of insanity is to keep doing what you've always done and expect a different result. So we know we're not meeting the mark, and in order to do that, we're going to have to do some things significantly differently. And I told, we have some time for questions at the end, but I'm more comfortable when I'm conversational. So if anybody has a thought or a question as I'm talking, please don't hesitate to let me know, okay? So a lot of this is going to be preaching to the choir, right? This is mental health and ag, this is what we know. Non-metropolitan populations, rural populations, and the tricky thing there, of course, is that there are several different definitions of rural, right? And even the federal government has like 7. So how many of you consider yourself to be from or to work in a rural area currently? Okay, so based on what definition you're looking at, that could mean that you're not within 50 miles of a community of 25,000 or more. It could mean that you live in or near a community of not greater than 2,500 people. It could mean various things. Most of the clinics that I work in are considered frontier counties, which is beyond rural. And the definition of that means there are fewer than 7 persons per square mile in those communities. So these are truly rural. We have way more cows than we have humans. So what we know about those kinds of populations is that they have the same mental health issues seen in cities, but sometimes at different rates. That rarely goes in our favor. So we find typically that the rural areas actually experience those same problems, but often at higher rates even than are seen in the cities. And this goes directly against what the prevailing wisdom was, say, 30 years ago, which is that cities have all the real significant problems, right? And rural areas are these nice, idyllic, peaceful places where people don't have stress. Not the case. The things that we tend to see especially are things like adjustment issues. And that means you're not crazy, but life is crazy, right? That is a person adjusting to some life event. And it might be short term, but it's a significant impairment while it's going on. Depression and anxiety also tend to be pretty frequent flyers. And we'll talk about a little bit about some of the others. We also know that rural communities have higher percentages of mental illness, more serious mental illness, and higher rates of substance abuse than urban areas do. So not only do the problems occur as frequently or more frequently, but they tend to be pretty severe. Why do you suppose that would be? Yeah, so when we started providing services in some of the communities 18 years ago that I work in now, the first referrals to come through the door, we started calling them with the families. We referred to them as kind of train wreck situations, right? Because it wasn't just one problem. These were sometimes generational problems, things that maybe they started out something relatively small back in the day, but there were no services available. So they compounded over time. So, yeah.
A friend of mine, I guess the analogy that I'd like to throw out there is he calls it, where we're at in our area, it's high stakes gambling every year.
Yep.
And he says it used to be you bet, you anteed in, whatever, your input costs. He says now, we're pushing all of our chips in every year.
Yeah.
He said all of the expenses have gone so high and the margin is so tight. And I when have you ever seen someone that was addicted to gambling that didn't look like they were on the edge?
Right. All the time. For generations. And what happens when you're that on the edge for generations? Like what happens to your ability to parent effectively? What happens to your ability not to overuse alcohol? What happens to your ability to kind of care for your community? So it just becomes this compound issue over time. I think that's a really good point. We also know that suicide rates, and especially in the last several years, have really escalated in our ag communities. And one of the most disturbing pieces of research I found, and it's a little hard to pin down, right? Because a certain percentage of the time we don't know that it's suicide that took somebody, right? We know they died suddenly. Sometimes they die suddenly of heart complications or whatever, and we don't really know. But as best they can figure, males, especially in farming and ranching occupations, have 43.2 per 1,000 rate of suicide. And that compares to 27.4 per 1,000 rate in males working in other occupations. So this is a dangerous occupation for suicide, for men in particular. And when we talk about why, you brought up an excellent point, just the chronic stress of that work, right? That doesn't stop. Even when you're in a period of time where the gambling is good, where you make the right bets, there's still the stress of doing it day to day. These populations tend to be very isolated, often geographically isolated, but even when they're not as geographically isolated, the work tends to isolate you from other people. Family tensions tend to run high. There is something called ACE, Adverse Childhood Experiences, which they assess within rural populations. And within the study that they did, they looked at a 2-year period, and they found that 56.5% of the ag people that they surveyed had an ACE within the past 2-year period. So those are things like domestic violence, those are things like child abuse, those are things like significant substance abuse, something that impacts kids negatively. And of course, there are also generational issues. We talked about generational issues of depression and anxiety that are not treated over time, generational issues related to that kind of stress going on over time, and then generational issues, and we heard a little bit about this earlier this morning when Jess was talking, about the younger generation making decisions about their own lives and what's going to happen to the family farm, to the family ranch. So lots of generational stressors. Also financial issues, debt, variable prices, natural disasters, unpredictable weather, all of those things that so impact the day-to-day work that aren't in our control. And yeah, go ahead.
How did you deal with the spring of 19 in our state particularly?
Well, I mean, the thing is that one of the issues is that we don't tend to deal with it at the time in my profession, right? So we tend to see it fall out later. So our communities deal with it, neighbors deal with it, and then we deal with what's left, often a year or so later.
So we're still seeing people come to the surface with issues that were started in that winter
Yes.
of 18 and 19 in Nebraska.
Yes.
When you couldn't make it move right.
Right. But it's a delayed thing, right? It's a delayed because those people, the folks who are most impacted don't come right in the door. It's down the road months and years. And for those who aren't from Nebraska, do you want to?
18 and 19 was, I'm going to kind of bare my soul a little bit here, because that was, till you drug piles of dead cows, you don't really know what it's like. And the guilt that you deal with.
It wasn't just dragging dead cows, you had all the rest of it coming too, and you knew it, didn't you?
Yeah.
That was just the immediate.
You knew that you had no chance of making that year's loan payment, and the next year was going to be just as bad. We're still digging out financially.
Yeah.
I called Ryan in the spring of 19, just before I pulled my four-wheeler up on a railroad track. Ryan asked me, he said, "What are you doing?" I said, "I'm thinking about derailing a train with a Honda four-wheeler up on the mountain." I drug cows all winter, all spring,
Yeah.
And those are things that, like you touched on, the not, that is just another careless ration.
Yeah.
I think there's a substantial number of these.
Accidents.
These found somebody in a grave.
Yep.
We find somebody in a
Yep.
pit. We find, yeah, he knew better than to do that.
Right.
Why did he reach into that electrical box? Why did he do this? And that was.
Well, thank God you called Ryan. And as we talk, I'd like to talk about how you were able to do that, because that's the key, right? That's ultimately what we've got to do, because you folks are living in this day to day. And if you don't have a Ryan, what do you do, right? Yeah. Thank you for sharing that. We have heard so much today, people being willing to be vulnerable and share some of the experiences that so many of you have had, right? And that is so important to being able to reach people and provide the kind of help that they need. And we know that there are a lot of obstacles to that help. I mean, there's not just one. It's not just if we take care of stigma, everything will be fine. Stigma's a big one. I got a bone to pick with stigma. But it's not just that. There's so many more things standing in the way. And when they've done studies, one of the first ones is cost, right? So many of our ag folks have catastrophic insurance, if any, right? So the catastrophic will cover you if you have to spend some weeks in the hospital, or at least it'll whittle that bill down a bit. But it often doesn't provide much for mental health care, or it has a great big old deductible. And so you're paying out of pocket until you reach that. And so cost is a big issue for a lot of our folks. We already talked about availability. These communities tend to be underserved. There aren't enough rural behavioral health providers, or if they come, they don't tend to stay. 20 years ago or so, they started doing some programs, loan repayment programs, things like this, to try to kind of lure people to rural areas to provide service. What happened? Anybody know?
They got hired somewhere else for more.
No, they went. They went for the required number of years to get $25,000 or $50,000, and then they left because they had no ties to that community other than the lure of that money. And so they came, they fulfilled their terms, but the vast majority of them didn't stay.
And there was nothing there to draw them either.
If they weren't connected already.
So passionate about what they were doing.
Right.
Our rural communities don't draw somebody from an urban area very well.
Right. Yeah, my little town, love it dearly, but if I didn't grow up there, I mean, we don't have a stoplight, we don't have a movie theater, we have a coffee shop, so that's good, but really that's about it, right? We can go out to eat at 2 places in Rushville. Yeah.
But there used to be 7 bars.
Well, there did used to be 7 bars. Ryan's telling the truth. Okay, so availability is a big issue. We're working on that. We're working to train more people. We're working, as I'll talk to you about in a little bit, to grow our own, which I think is an even more powerful idea. Instead of trying to lure people in and convince them to stay, to grow our own. Accessibility is also a big issue. Again, the distances. And what happens when you have to drive an hour and a half each way to get to your therapy appointment plus an hour there? Where are you not? You're not farming, you're not ranching, you're not doing everything that needs to be done. So most people don't do it, okay? There is stigma. And we're hearing more and more over time to break that down, but it is still a real issue. So a certain amount of the work that I do right now, I do in the schools as well. So I'm trying to reach our kids there. We do a thing in the Gordon Rushville Consolidated Middle School that's a stigma reduction program. And the idea is to just go in and educate people, to talk to them about depression and anxiety and the effects of stress over time and how to be mentally healthy and how to know if you're not and who to reach out to and those kinds of things. I went into the high school a couple years ago, the reason we're doing stigma reduction, and they asked us to talk to their high school students about emotional wellness. So we talked to them about all kinds of just happy ways to be well. And then at the end of it, we talked about how there are some things you can't control, and there are some things that just these healthy things aren't going to help with. So how do you know when it's gone beyond your own ability to just stay well, and how do you know when you need some help? And we talked about that. And then we talked about, worst case scenario. People sometimes get to feeling like they don't want to be alive anymore. How many of you in this room, I said to these high schoolers, if you were at that point and you didn't want to be alive anymore, how many of you would be willing to reach out to an adult you trusted? 75 kids in that room. How many of them raised their hand? 3 kids. And I said to these kids, a lot of whom I've known since they were little, I said, that scares me to death. Because what you're saying is that you would literally rather die than let somebody know you were struggling. Broke my heart. And I asked them, why? Like somebody who didn't raise your hand, why? And those were the things they said. I wouldn't want anybody to know. I wouldn't want people to think I was crazy. I wouldn't want people to think I was weak. I wouldn't want to worry my folks, right? So we've got a lot of work yet to do on stigma. Embarrassment was right up there. And they differentiate in the research stigma from embarrassment, right? Stigma is feeling like people have negative attitudes and beliefs about mental health, and or you have negative attitudes and beliefs about mental illness yourself, which I think a fair number of people probably can cop to that. But embarrassment is slightly different, which is just maybe you don't, but you're afraid everybody else does. Like maybe you're willing to be open and you're willing to be vulnerable, but you're embarrassed because you know how other people are going to view you. And then the last one that was over 50% of the respondents was awareness of mental health. So I think we can't forget that as well. And what that means is you don't know enough about mental health and mental illness to know when there's a problem, to know when you shouldn't be able to just pull up your bootstraps and move on.
Dr. Baker,
Yeah, yeah.
How many times do you see when it's probably the burden carrier for a family or for a community that eventually ends up on the implosion?
Oh, so how many times do they make it in the door?
Or do they end up being,
They don't. They don't unless they're bringing somebody else in. Sometimes we catch them then, right? Sometimes we can identify it then. 9 times out of 10, they're carrying everybody's burdens, and they're not going to put them down to take care of their own. But a certain number of times when they'll bring a kid in, then we can make contact with them because those folks tend to do more. You know, that's part of that carrying the burden. And so sometimes we can then. Yeah. So part of this is, yes, we're going to continue to fight the good fight. We're going to continue to try to bring people in who are trained to do this work. And we're going to try to continue to support them while they're there. So recruitment and retention, right? Bring them in, and then let's support them. What do you need? What kind of resources, like what kind of supervision, what kind of support can we provide to get you to take up roots here? But aside from that, we want to do some things different. So that's why our clinics, and a number of clinics in the state of Nebraska at this point, function with this primary care integration model. Okay, so we know again from the research, because I always like to go back to what the numbers tell me, 82% of rural people who were surveyed, they surveyed like 4,000, indicated that they trusted their primary care docs for mental health advice specifically, more than anybody else, right? More than they trusted their friends or their family. They trusted their primary care doc. So when we are able to be in there with the primary care doc and they say, you know what, this is out of my realm, but let me walk you down the hall. I've got somebody here that can help you with this. Then we get linked automatically to that trust because somebody they trust has brought them literally to my door, and it makes a big difference. Also, they don't have to stop 4 places. So if they're on a medication and I'm working with them and they say, I'm worried about this side effect, I can literally say, hold that thought, walk outside the clinic room, find their doc, and 9 times out of 10, the doc doesn't just tell me what to tell them. He or she walks back in the room with me to have that point of contact. So it's a really good way to provide more full care. Also, it reduces that embarrassment, that stigma, because when I was growing up in Rushville, there was a psychologist in Rushville. Her name was Dr. Wasserberger. Some of you might know the Wasserberger name from back in the day. She lived in a big yellow 2-story house at the corner of Highway 20 and the street that went to the high school. And she had her office in her house. So those of you who live in little tiny towns, tell me about that. Tell me about that if you got referred to see Dr. Wasserberger as a high school student. You better not park your truck, right? right? Yes, you'd have to, and those two are the most visible streets in the town as well, right? Then compare that to being able to provide integrated care in a medical clinic where a parent said once, I can be in the parking lot and they don't need to know if I'm here for a therapy appointment or to get a shot, or they don't need to know why I'm here. It's nobody's business. So it does increase comfort in that way. The other issue is even once we have the providers, getting people to be able to come. So the willingness to come. We have to start working to provide more creative times and places to access ag producers, partly because of the convenience factor, partly because the lack of awareness of where to go, even once you get to the point where you're ready to go. So we're starting to explore things like extension offices, ag meetings. A couple of years ago, we had a lender from the local bank contact us because they were so concerned about the wellness of some of the folks who were in their office, right? Who were hitting that point of financial crisis. And these folks in the bank knew trouble was coming. They knew things were bad and they didn't know how to help. They didn't know where to direct these folks. So we were able to put together a packet of information for them that had a really thorough referral list, and it had just some information about stress and the toll that it takes and what depression looks like and how depression is super normal with chronic stress and how it can be treated. So that's one thing that we were able to do, but I think we need to do more. We need to train those folks, maybe in QPR or mental health first aid or something along those lines. What's that?
Was that David?
No, it was actually Valerie and Gordon. Yeah. And podcasts, right? Like folks spending a lot of time in a vehicle, listen to stuff, and we can get information to them in that way. We also need to, I think, rethink some of our traditional therapy practices. And Ryan and I talk about this all the time. Most of our mental health providers, myself included, were trained where? And where are colleges? In cities. And especially higher levels of education, like a PhD, you don't find those programs in Chadron at a state college. You have to go to a university, and those are urban settings. So a few things happen because of that. Those folks don't end up being particularly in touch with an agricultural lifestyle. Even if they are, they've been away for a really long time and they've made connections and they've put down roots wherever they had to go to school for 6 years. Which means that even if we can kind of nudge them out to the rural area, they're gonna, rubber band back to where those connections are, to maybe where their preschooler started school or where their wife got a job or their husband got a job. So we need to work on that issue of who we're recruiting. But connected to that is that traditionally in therapy, as a psychologist, as a mental health counselor, you're not supposed to provide services to anybody you know in any other way. It's called dual relationships. And it used to be that the Code of Ethics prohibited dual relationships. So if you had a relationship outside the therapy room of any kind, you were supposed to refer a person on.
So we just get together.
Yeah, right. So 20 years ago when I did my dissertation, I did it on this topic. And some of the stuff I read, it said things like, if you're going to provide mental health services in a rural community, don't live in that community. Or if you have to live in that community, don't participate in any community organizations, don't belong to any clubs, these kind of things to reduce the risk of a dual relationship.
Get it to where you need therapy.
Yeah. Well, not only that, yeah, you're exactly right. So first of all, what a way to live, and who's going to want to live that way for 50 years? But second of all, tell me about the community when there's this person in there who has no connection. They're not going to trust you, right? No connection to the community. So we, in our clinic, we train a lot of students, and we train them with a different model, which is you're not going to avoid dual relationships. I'm sorry. So here's how you evaluate them to make sure that they're ethical and responsible and you're not doing any harm, right? Don't have sex with your clients. Don't take on a therapy client you've had sex with. Don't treat your boss or your spouse's boss. Those are obvious ones, right? But if there is another relationship, let's evaluate it. And odds are it's still going to be ethical to provide services. And in fact, I've had so many people over the last 18 years who the doc said, let me refer you to somebody. And they were like, I don't know, until they found out who it was. And they were like, oh yeah, she's bought flax from us. Or, oh yeah, I know her dad or whatever. So it actually, for rural populations, increases the trust, increases the confidence, and people are more likely to want to talk to somebody they know within limits. Did you have a thought?
Well, I'm just curious, when people are students, people who are going to school, do you think or are we seeing maybe like a split of some people who go off on this only rural mental health type career path or becoming trained? Because I know a few people would have done something.
A specific program, yeah. So there used to be, UNL used to have a specific rural track, University of Nebraska-Lincoln, and they ended up having to do away with it. And have it be more general training. So I think there are definitely those programs. What we find now is that our students, doctoral interns and so forth, they tend to be more trained in general programs, and then they specialize during an internship or during a practicum, and that's where we can reach them and we can train them. And that's fine that they came out of undergrad thinking you should never ever see somebody as a client if you've seen them across the street, because we can work with them on that, right? We can bring them back down to reality.
What about, has there been any effort, or what has been the reception from people in the churches, in the religious affiliates, as kind of a triage mental health?
Yeah.
I mean, that's where I think everybody trusts their pastor.
Yep.
They should.
Yep.
And you've got a lot of them in these rural areas.
I'll be honest that it's mixed, but more heavily towards the positive side. So over the years I've been there, I think it's been more largely cooperative and collaborative, right? That people go to their pastors, and then if their pastor is dealing with them on something that they feel like is beyond the scope of what they feel comfortable, then they give me a call. Right, and vice versa. If I'm dealing with something with a patient and I'm more like, this is more a crisis of faith, let me give a call to my buddy Russ, right, who is a pastor, but also has some mental health training, and he can address that with them. There are small instances where people are led to believe that if they have enough faith, they shouldn't need anything else. And those concern me, because then the person, in addition to being severely depressed, feels like they're failing in their faith. And those are hard situations.
With that being said, it gets to a point to where you don't feel like you're worthy of saving by anyone. And that's the dangerous part.
Right. I need to wind up.
I just wanted to throw this out back on the last slide. I'm from North Carolina.
Yeah.
And back in 2019, Dr. Robin Markham with the North Carolina Medows Institute, she actually did trainings for extension agents in North Carolina to recognize depression, helping them understand mental health issues so that they were out visiting farmers and they could recognize this and then start making referrals to mental health professionals, because it's just not a Midwest deal. It's
No.
Coast that you're seeing a lot of this go on. Bigger companies going out of business.
Right.
People losing multi-generation farms, and so there has been in North Carolina some effort for extension to do some of this recognition as well.
And that's actually a nice segue to our very next point here, which is I think more of what we need to do is to train peer and other professional supports, folks who are coming into natural contact with folks who are struggling, extension agents, again, lenders. How many folks know about QPR? So it's called Question, Persuade, Refer. And I'm just going to take 5 more minutes because I won't do questions at the end, and we'll make sure Jason has plenty of time. And it's specifically a training to help people who are non-behavioral health or non-mental health providers recognize somebody who might be at suicide risk and provide basic triage, right? That's just, they're not going to try to treat them, but just to identify, provide basic triage and help them to get somewhere they need to be. Mental health first aid is similar. It's a training that's designed for non-mental health folks to be able to provide some help. Again, I already talked about work in the school. I think we can expand it to 4-H. Work with our youth to break down the stigma so they don't become adults who are paralyzed by that when they need help. And then I just want to give a quick shout out to something that I'm really proud of that we've been doing for the last 8 years, which is something called Farm Camp. And we talked about how when you try to lure people to a rural area and they don't have roots, it's a hard sell. So we've been working with this project we call Farm Camp, which stands for Frontier Area Rural Mental Health Camp and Mentorship Program. And it's an annual camp for high school students who are exploring careers and have shown or expressed some interest in mental health careers. We bring them in for a week to Rushville, Nebraska, and we provide a college level course that they get 2 college credits from our local state college. And they learn about mental health, they learn about different careers available, they meet rural mental health providers who come in all week long and talk to them about what they do, how much schooling was required, what they like, what they don't like. They get assigned a mentor who follows them, well, really forever, because we're still in touch with the first group of campers who went through now 9 years ago because of COVID. So to me, this is part of the answer to not enough providers is we got great young people in our communities and they tend to go somewhere else. Right? If they're not into farming and ranching, they tend to go somewhere else because there aren't a lot of other jobs. And we need people, and we have kids who are interested. It's a match made in heaven, right? We need to focus more on growing those kids. I also just wanted to mention regarding the cost issue that there are now programs in almost every state that are targeted towards helping provide mental health services for ag populations who might not be insured. And I mentioned a couple of them here, but if you Google a similar program for about any state, you can find them. And they tend to provide maybe 8 to 10 sessions for folks who are uninsured or underinsured. And then, of course, you know, our hotline information and a bunch of references.
State of Nebraska has Lutheran Family.
They have Lutheran Family Services, yeah. And the COMET program is through Interchurch Ministries, and it's an amazing program. Yeah, we've had so many folks over the years who were able to get services at no cost, who wouldn't have been able to. Done. Landed the plane.
You gotta throw your hand up like you're pinned.
Done. Time. So.
Folks, if you need a copy of that last slide,
Any of them.
send me an email and I'll get it to you. So, thank you, Dr. Cate.
Yes, thank you.
Okay, so I'm going to introduce to you Dr. Jason Medows from Cuba, Missouri. He's the owner and founder of Ag State of Mind. Jason was born and raised on his family cow-calf operation outside of Cuba. He grew up playing football, baseball, as well as involved in his local 4-H. In 2002, Jason left from the farm for St. Louis College of Pharmacy. He graduated in 2008 with his doctor in pharmacy and returned home to work at the local hospital and continue the cow-calf operation he started in college. I'm trying to, sorry. Fast forward 12 years, starting college, he was at the local hospital when he met his future wife, Carrie. Fast forward 12 years, and they have 4 boys and have purchased another farm of their own. In 2019, Jason began his podcast, Ag State of Mind, where he combined his medical background with his passion for agriculture to help break the stigma surrounding mental health and agriculture. Welcome, Jason. Thank you.
Is this on? I don't know where my slides are. Sorry.
That's all right.
Here we go.
got 'em?
I got them. All right.
I was gonna say you're out of luck. 'Cause I don't either.
Sorry, I don't use PowerPoint. Everything I usually use is in Apple, and I'm not smart enough to. Is this it here?
Nope, down here.
No?
It's, you click on this little guy right here. Right next.
Oh my gosh.
Next door to that one.
We're having a hard time here.
Right there.
All right. There we go. All right. Guys, I appreciate you being here. And Ryan, Dr. Cate, I appreciate you guys. Ryan, this morning, your story, it hit me, every single part of it, because I related to a lot of it. So I appreciate it, and I appreciate you, and I appreciate the opportunity to be here. Just to touch on a little bit of who I am, Ryan kind of introduced me, but I'll kind of go through it again, who I am. I was born and raised on my family's cow-calf operation. I'm the youngest of 5, and when I say I'm the youngest of 5, that does not really do it justice. My oldest brother is 25 years older than me. My youngest brother is 13 years older than me. I know what you guys are thinking, and I know I was an accident. You guys can all, well, somebody once said it that I was the best accident my folks made, so I'll take that. Grew up doing all the things because the school was small enough where I could do all the things. Played football, baseball, active in 4-H. Then in 2002, I was deciding between a football scholarship and pharmacy school. I think wisely I chose pharmacy school and left for St. Louis. Now, for anybody who doesn't know, which I'm sure a lot of you, Cuba is only about 80 miles from St. Louis, but it may as well be 500 miles away. That's how different it is. And that was a huge adjustment for me. And I'll talk about it here in a minute. That's when my challenges with mental health really started to manifest. But I did manage to get through pharmacy school, even though I wasn't sure a few times. The whole first week of school, I missed dinner because they stopped serving dinner at 6 o'clock and it was still light outside. We never ate dinner until it was dark outside. So I had to eat ramen noodles for the first week because I didn't understand why city people would eat dinner when it was light outside. So, I eventually made it through that and went to work at a local hospital. That's where I met my wife. She was actually just finishing nursing school. And now we have 4 boys, 2 dogs, cat, horses, 150 cows, and 2 farms, and not a lot of free time. So my wife and I actually are here together without our boys. We try to make that happen every once in a while. But it's on the plane ride here, we got a call right before she put her phone on airplane mode that our youngest son had ruptured his eardrum. And you can imagine how that sent Mama into a fit. But thankfully, we have good friends and neighbors to help us out with that. So, like I said, I've had my own journey with mental health. Going from that small town to a big city was a huge adjustment. Did really well in school and high school, and I didn't have to try that hard. I played football, baseball. I played basketball until they asked me not to play basketball anymore because I was too rough on people. So when I went to pharmacy school, my first test was a calculus test that I failed. I never thought you had to study for math tests. So I didn't study for math tests, and that got me an F on my first test in college. And I called my dad. I said, Dad, this school's too hard for me. I'm not going to be able to make it here. And thankfully, he talked me out of it. And but still, I had the whole time I had a hard time coping with the stresses that were school. And it was a really, really difficult time for my life. And I'll talk about it probably a little bit later too, but I went to alcohol. That was my coping mechanism of choice, and it was really hard for me for a while. It was a numbing thing, and it's thankfully something I was able to overcome in time. But that's just kind of a really brief synopsis of my own mental health journey. But as far as how I was involved in agriculture, my dad helped me get my FSA, first-time farmer's loan, in my second year of college to help pay my rent and things like that, pay for my books and stuff. And in exchange, he would help me feed him when I was at school. And in exchange, I would help him when I was home on breaks. And I think I got a pretty good deal on that. But along the way, the whole time, I found this need to want to combine those two worlds of medical and agriculture. And it just seemed like it was such a hard thing for me to do. And through college and even after college, I really wanted to find a way to put those things together. And it's interesting that you guys talk about the 2018, 2019 Nebraska crisis, I guess.
When a foot and a half of snow that's been on since Thanksgiving melts one afternoon in the end of March and has 2 inches of rain falling.
Well, I tell you, the reason I say that is because that was sort of a catalyst for me to start this podcast, that whole crisis. Because I was listening to a podcast I'm sure many of you are familiar with the Working Cows podcast. Aaron Berger and Clay Connery were talking about that. And Clay, it was just this little small snippet in there where Clay talked about the mental health of the people involved in during that whole deal. And that got some gears turning for me. And then in 2019, we were away at a conference in Dallas. My wife and I, again, we left the kids with Grandma and Grandpa. It was after the county fair, but before school started. We wanted to just take some time away, but we still had hay to put up. It was up to my 83-year-old dad at that time and 14-year-old son to put up what hay we had on the ground. Well, I got a call when I'm sitting in a hotel room in Dallas, 8 hours away from home, that the tractor was on fire. My son was baling hay, which is totally capable. I'm sure if you have any farm kids around, you know as soon as they're able to do things to help, you try to make sure they can do that. And he was more than capable. I watched him many times bale hay without any issue whatsoever. And I think a bearing must have caught fire on the baler, and we lost it all. We lost the tractor and the baler, which obviously is not significant in the grand scheme of things because nobody was hurt. And we had to go through all the motions of, do we go back home? Because we were, like I said, 8 hours at home. Carrie was still at this work conference. I was by myself. I would have had to leave her. She would have had to fly back home. I don't know what would have happened. But a part of me, I knows that at one point in my life, I would have just went ahead and gone home. Even though I wouldn't have done any good, everything would have been taken care of by the time I got home after that 8-hour drive. But I know there was a part of me that at some time in the past would have went back home. But I realized that I gotten better, that I had done the work to make myself better. And at some point during that trip, on that drive home, I realized that if I struggle like that, there has to be other people that struggle like I do. There has to be people who have these things that they have to compete with. And I'm not exactly sure where it went from that point to actually a podcast being the way I help people, but it was. And man, am I so happy for the opportunities that it has afforded me. So, like I said, I have a 3-pronged approach to the podcast. I'm a healthcare provider. I'm a pharmacist. I've worked in a rural setting as a pharmacist for 13 years now. Ag producer. We have, my dad used to own the local livestock barn in Cuba. He sold it when I was pretty young, but we've still had a cow-calf operation and continue to have a cow-calf operation. And then again, my own personal battle with mental health. A journey, I think, is probably a more appropriate term because it's not something that has an end to it. It's something that will continue for the entirety of my life. And I think with these 3 things that I have, gives me a very unique perspective into what's happening in not just in agriculture, but in the rural state of minds of people across rural America. So the first thing I want to talk about is, what is mental health and what is it? Dr. Cate, I'm going to ask you a question. Have you ever had a heart attack?
I have not.
Do you get your blood pressure checked every time you go to the doctor?
Yes.
But you've never had a heart attack, have you? So shouldn't we see mental health in a way that is very similar to that, in a way that's more preventative than working from behind? And that's the way I kind of like to see it. Every single one of us should pay attention. It should be just like getting our blood pressure checked at the doctor's office. I don't know if there's and I think that's a really hard thing about mental health is there's not a blood pressure reading or a blood test that we can get to say, oh, you have depression or you have anxiety. It's not as simple as that. So I think it's really, really hard to for a lot of people to grasp that. But once we grasp that, once we understand that it exists on a spectrum and that we each have to pay attention to it, then I think the recognizing it and treating it is going to become much easier. And so, and I know Dr. Cate touched on this a bit, but how does mental health affect us in ag? And this is a several part thing here that I have. But the first thing is the seclusion and the isolation. And seclusion and isolation is a very loaded term. It's something that we can all experience no matter where we're at. I mean, you don't have to feel secluded and isolated physically. I mean, you can feel that way in a room full of people. So, but there was a BYU meta-analysis that I found that said that a lack of social connection can be as harmful as smoking 15 cigarettes a day or having an alcohol use disorder. And then it's also it can be as harmful as obesity. And I know that COVID just put this into, mass perspective, and it amplified it. And the ways that we were able, Dr. Cate was talking about being available in your community organizations, going to ball games, organizational meetings, things like this, ag events, fairs, all those things, they went away for a while. And for some people, that was the only way they got any sort of social interaction. And to take that away all of a sudden, it was, it made a bad problem even worse. So, and then there's a lack of control, and we talked about this as well. And I came up with this little scenario of all the absolute worst things that could happen in a given day at my place. Now, before I say this, this is not a true story in the fact that it all happened at once, but it all did happen. So it's always this time of year where we wean our spring calves, and we have about 60, 70 calves in the lot. But the day before, it rains about 3 inches and turns to be about 37 degrees, which in my opinion is the worst weather imaginable. You get the calves up, and when you're sorting them, a gate busts open and all the calves start to get out. Well, you tell your son to jump the gate and go get those calves back in before they get out even further. Whenever he jumps that gate, he slips. When he slips, he falls, he breaks his leg. So not only you're down a person, then your wife has to take him to the emergency room to get his leg looked at. Well, you and the hired man, you finally get all the calves back, sorted and ready to go. You get them on the trailer. On the way to the sale barn, the trailer blows a tire, and you've got to call your neighbor up, and he's got to come bring his truck and trailer, back it up, put all the calves on his trailer, take them to the sale barn. You finally get them to the sale barn. You do this on the weekend. On Monday, there's a fire at a packing plant out west, and your calves are worth about $10 to $15 less a hundredweight than they were the week before. And not to mention your son, who turns out that he had to have surgery on his leg. Your insurance, the physician, the surgeon who worked on his leg, he's not in your network, so you've got to pay 30% out of pocket for that surgery. Now, that's an extreme situation, but it's all of those things at some time have happened in our place. So, and then there's the misunderstanding of the lifestyle, and I think this has really been brought to focus over the last years, that there's a disconnect between producer and consumer that seems to be ever growing, and there's a misunderstanding at kind of both ends of the supply chain, and that's really difficult for a producer to produce a product that somebody on the other end may or may not totally trust. And, it's frustrating, and it's hard, and there's narratives out there that you have to contend with. And, these are things that keep people up at night. Again, it's, like you say, it's animal activists, but, there was also, and this happened to me last year, I think. There was a local outlet, it was a local health organization that prints this calendar for the year. And in that calendar, they were giving like healthy recipes. And one of the healthy recipes called for a meatless chili. And it shows me that it's not just in urban areas where things are becoming less connected. It's also in the rural areas too, because this health organization, where it serves, I mean, it's a predominantly rural, and not only rural, but I mean, it's some of the biggest beef county states in the country where, that this area serves. So it goes to show that the disconnect is going all across the board. And then there's comparison syndrome, which is probably the one I'm most guilty of. Who knows what this is? What kind? It's the best kind. In my opinion, that's my opinion. I'll take that. They had one at our local feed store, and man, my kids would just love to go with me to the feed store when they had this out there because they just love to play with it. Now, this is what we have. It's nice. It's a WW. It works. It's good for our kids and me to work cows with, because that's all we have is the family. And I didn't think it was that old until I got to looking at it the other day, and there was an old tag on it and we bought it from Rolla MFA, which is a co-op feed store down the road. And it's when Rolla still had a 314 area code number. Now 314 is exclusively for the city of St. Louis. So we've had a 573 area code for about 30 years now. So it's got some age on it. No, it's better than a lot of things, I know. But yeah, exactly. Well, and the reason I put that up there is there's this guy I drive by every day on my way to work from my farm to Rolla is about 25 miles. I work in Rolla, and he's got one of those Aero Q catches, and he's got these pipe fences. They're immaculate. His everything is just his fence lines are always clean. His pastures are just beautiful. He's got a fence around this beautiful pond. And, I was like, man, I always just look at that guy. I'm like, man, that place is nice. It's nice. And then one day I got to driving by it. And I got to thinking, I was like, I wonder how much he enjoys everybody every day on their way to and from work going down Interstate 44, just staring at his farm. How does that make him feel maybe? My place is back in the woods. Nobody sees that place except for the UPS man and the Jehovah's Witnesses. So there's something to be said. And I think what the biggest thing about it is we all have a cross to bear. We all have things and it's like Ryan said earlier, we all have something that we're struggling with. We all have something that we have to deal with. And, that's not always out there on the surface. So just because that guy has that immaculate looking place that I think is immaculate, that I think has the best squeeze chute, obviously that's not consensus. It's not as idyllic as it may seem. And then we'll talk about stigma, which Dr. Cate talked about this. We talk about this. This is probably one of the most talked about things when talking about mental health and ag. And it's kind of like that Rubicon. We have to get over that, and there's no turning back. But we have a good start. The fact that I'm here today talking to you guys, the fact that we had that session this morning that was phenomenal, those are really good starts. There are organizations like NatGLC that are making that a priority, but there's also organizations that still are lagging behind. And it's still something that they talk about once and may not revisit. I think it's something that needs to be you don't drive a nail with one swing of the hammer. It's something that you need to keep going on. And there's this independence among farmers and ranchers that is very valuable. It's gotten us through some really tough times. Like you said, when we talk about the things with Nebraska, that's just one example of how bad things can be. But resilience has gotten us through really tough times. But at the same time, it doesn't always lend itself to outside help very well. Whenever you're super resilient, super independent, and you've been super isolated and you're only used to being able to rely on yourself, it's not very easy to look for somebody on the outside to help you out. So now I'm going to talk a little bit about solutions, and I make a point never to discuss problems without bringing up some solutions. And so I'm going to share some of my own solutions, and then I'm going to share some solutions that I have learned from others. And and I'm still working on mine, as I'm sure many people are working on theirs as well. And obviously, I'm not perfect. The people who have shared their solutions aren't perfect, but I sure as hell think that we're all better than we used to be. So my number one thing that I do now that has had a meaningful impact on my mental health is I exercise. And I exercise as much as I can. In fact, 2 days ago, I ran a 15K, which is about 9.5 miles, after a weekend spent in Vegas with my wife at the NFR. I don't suggest that at all. It was terrible.
I wouldn't go to the NFR either.
I actually enjoyed that part. But it was obviously, I think as a man, a lot of people say any kind of thing that was helpful in their life was probably brought on by the influence of a woman. And as you can see, I have a beautiful wife. And if you're wondering how an ugly guy like me got a beautiful wife, it's because I have a lot of personality.
I'm just wondering what she turned loose to chase you to get you to run 15K.
Probably food at the end. And is it hard to do? It is hard to do. There's some days I don't want to. There's some days I don't want to exercise. But it's the feeling, how do I say this? I know what it feels like not to, and the fact of avoiding that now is more important to me than not getting it done, than the rest or whatever may come, or the being lazy. That's more important, if that makes any sense. And I'm proof that barriers can be overcome. I have a lot going on. I mean, work, podcast, 4 kids, cows, all the deal. I still manage to get 45, 60 minutes a day, 5-6 days a week. But you know what? I don't watch TV. I don't do a lot of things. I don't spend a ton of time on my phone. And I started small. I started 3 days a week for 20 minutes per day, and then I built up from there. And you got to prioritize your time. And there's times where it didn't happen. When we had that hard freeze earlier this year, or whenever that was, February, when I was cutting ice for 2 weeks, I didn't do much working out. Well, hey, you're the one that said it. Everybody's struggle is their own. Don't make fun of us poor Southern people. Yeah. So now we can say, you can say, well, you can fit it in because, you're not full time. It's not that important to you to have, you have another source of income, which, whatever, I don't think that's a valid argument, but I can't argue with it either. But my friend Jared McDaniel, he lives down in Oklahoma. He's a podcaster, full-time father, husband, father of 6. And he still makes time to run, work out every day. And he told me one time that he's going to do it every day until he can't. And then there's my friend Dan Byers. Dan Byers is full-time farmer. He runs a custom salad shopping business in Illinois. Yeah, it looks it, doesn't it? He's one of the most impressive guys that I've ever met. I'll never do the work to look like Dan does, but I definitely can admire him because of he has this thing he says it's no excuses. And he gets it done. So the next thing that I do is I read and I journal. And, you know, I fill dead time. And by reading, I don't necessarily just mean I sit down with the traditional way of reading. I utilize audiobooks. I utilize podcasts. I fill a lot of dead time with this information, with this inspirational. It's not just podcasts and books. It's with my scripture reading too. You know, while I'm doing chores, while I'm driving in the tractor, exercising. It's been another thing that's just totally been a game changer for me. And just the way that I have filled that dead time has made a huge difference for me. And then, you know, I'm going to kind of call an audible here and say something I usually don't. And Ryan said this today, and we talk about the things that we all struggle with. And that's a big part of what I do when I'm journaling, is I write the things down that I'm struggling with. And one of the things I'm actually struggling with here today is the fact that I'm at a grazing conference. And I'm probably one of the world's worst grazers. I'll admit that right now. I try really, really hard, but it seems like anything I try to work on fails. You know, so I struggle with it. I struggle with, you know, kind of that imposter syndrome. But the fact that I'm here among you people, among the people who are also trying to improve themselves, it kind of fills my cup up a little bit. And, you know, the fact that I was intimidated to be here, that was going ahead and going through with it, it worked out pretty well. Hey, there we go. And you know what? And it goes back to what we talked about earlier, is everybody has, you know, it's not the way it seems. That makes sense now that you don't like arrow. All right. Sorry. See, I'm not like Dr. Cate. If you get me off on a tangent, I lose it. She's a lot better than I am.
The plane can't even see the airport.
We're in the fog real deep now. So, and this is something, you know, and so this was kind of hard. The last time I talked about this was in front of a bunch of college students. And so I'm not sure if this resonated with them as much as, you know, hopefully it's going to resonate with you, but taking time away. And I have 2 rules, and it has to do my rule of 5 is just myself, but my rule of 2 is with my marriage, with my wife. My rule of 5 is, whenever things are going wrong, whenever things are bad, seem as the worst they could possibly be, to take a break. And those breaks can last anywhere from 5 minutes to 5 hours to sometimes even 5 days. But take the break as long as it needs to happen. It's the loss of production that you may perceive that you would have in the 5 hours, 5 days, whatever it may be, you're going to more than make up for it in having a positive state of mind due to that break. And now there's no data. There might be some data is there data on this? Okay. I speak off the cuff a lot, so I try to be really careful and not say too many things that I appreciate that. But my other rule is my rule of 2, and I do think there is some data on this one. And our rule of 2 is, and this is with regards to the relationship with my wife, every 2 weeks we take a night out away from the kids and go on a date night. And now date night sometimes is going to a nice dinner. A lot of times date night is going out to check pasture, going out to check cows, going out to look at the heifers that are getting ready to calve. You know, that's sometimes it. Most of the times it's just, but whatever it is, it's just a little bit of time away from the kids to remember why we're married. 2 times 2 times a year, we try to take a weekend away. This is kind of counting as this time here. This week has kind of been one of those weekends away. And then every 2 years, we try to take a whole week away. And I know that that seems really difficult, and it was. It was difficult for me for a really long time. I think it was probably about 5 years ago we started doing that. And the difference that it has made in our relationship, it's made us not only a better married couple, it's made us each better parents, it's made us better at our jobs, it's made us just better human beings because we're just happier. It's made us happier. It's kind of left those struggles behind whenever, you know, they're there. They're going to be waiting for us when we get back. So if we can just kind of step away from time to time, it makes a huge difference. And Brian Alexander, you saw him in the video today. He's a friend of mine. I listened. He was also on Clay's podcast, on the Working Cows podcast one time, and they were talking about drought planning. And he says, when everything seems to be wrong and nothing can fix it, go on vacation. Upon returning, you'll see that the solutions come easier. And I 100% can attest to that once you go away, you see things in another part of the country or just off of your place, you're going to have some perspective. And I think a lot of times that's a lot of our biggest issues is we lack perspective. And whenever we can go and gain some of that perspective, we come back home and things just seem to go a little bit smoother. Now, this is probably one of my favorite stories of my podcasts. I think this week I released episode 115, I think. But still, the story that was shared on this podcast with my friend Nathan Brown is my favorite. I would love for Nathan to be here today, because what Nathan is, if you say farm boy, if there would be a picture of farm boy in the dictionary, it would have Nathan's picture next to it. He is just a good old Ohio farm boy, looks like one, talks like one. He is just an incredible guy. But not only that, he is probably one of the best advocates for mental health and ag that I know of. And he shared this story on our podcast. And he had a friend who, he had some hogs get out. And the hogs were, I'm not sure exactly what the situation with the hogs that were getting out was, but they got out. He needed help getting them back in. Nathan knew that this was unlike this guy to ask for any sort of help. But he instead of just kind of blowing it off like, because he said he had things to do that he probably didn't, quote unquote, have time to go help him. But something in the back of his mind said, no, I need to go help this guy. Well, he got the hogs in, and it turned out it was no big deal. This guy definitely could have gotten those hogs in on his own. But what happened after that is this guy kind of bore his soul, much like probably you did to Ryan. Kind of bore his soul to him, talked about the struggles that he was having financially, struggles he was having with his wife, with his marriage, with his kids. The farm was not doing the way he thought it should do. And they ended up speaking for 2 or 3 hours just there. And what kind of the lesson that comes with that is, always be mindful of others. Always be mindful when someone's asking for help. And even if it seems like it's not a big deal, it most definitely could be. And who knows what could have happened in that situation. Nathan definitely could have saved that guy's life. And, the story doesn't end there. The guy that, and I wish I could remember his name, the guy that Nathan helped that day, he's gone to become an advocate. He's a spokesperson for their local counseling because Nathan helped him go get counseling there. It just turned out to be a really cool story. I'm going to kind of breeze through here because there's a lot of all these resources are available on my website, agstateofmind.com. The Do More Agriculture Foundation, they're an incredible organization. They're actually based out of Canada, but they do some really good work that is really, really helpful. Have some really great videos, really great resources. The AgriSafe Network, they actually just started a podcast of their own, which is hosted by my neighbor, of all people, Carrie Portell, that's focusing on mental health and ag. And then obviously there's the National Alliance of Mental Illness, all kinds of resources you can find at my website. So I'm going to take just a little bit of time here, and I talked about this earlier with a gentleman. What's your name? I'm sorry. Sam, right. We talked a little bit about this earlier, and Jessica too. Medications kind of have a stigma all of their own. And I, for one, suffered from that as well, and which is kind of funny to me because that's kind of how I make my living is dispensing medication. But I was one of those people who thought that you know, you shouldn't need medications for mental health, that it was somehow different. And now looking back to how backwards that sort of thinking was from someone of my profession is really incredible. Like I can't believe I was kind of blind to that, but they can be an absolutely essential tool to someone in their, what I like to call, mental health toolbox. You know, there's something that obviously you should consult a physician in using, and you shouldn't use anything not approved. But they're something that they are a huge help, and I'll say it to myself. That's been another part of what I do that has helped me a ton. Somebody once said to me, I said, I'm scared of the way that they will make me feel. And then somebody said to me, well, do you feel normal when you don't take them? And the answer was obviously no. So, I mean, and that's the biggest testimony to that is they make me feel normal. I feel normal when I take medication. And I think that's going to be a lot of people's experience with them.
Jason,
Right.
medication isn't a life sentence either.
No, it's not.
Help you get to a point to where you can cope with whatever you're
Yep.
dealing with and then go off those medications.
Yeah, in fact, I'd say they're not supposed to be. You know, if it's done right, I mean, I think it's, and there are some people are born with a chemical imbalance, and they don't produce the serotonin that is necessary to have a healthy mood. And that's what a lot of these medications, especially the most popular ones are selective serotonin reuptake inhibitors. That's what they do. They kind of mimic the body's normal production of serotonin, thus, you know, improving mood. So, but back to what you were saying, no, they don't have to be. They can be a something that gets you through for a short time. Sam.
I'm not scared of hip hop. Hell, doing my extension job, I was under an immense amount of stress. I became extension director, kept all my programming responsibilities, convinced our county to build a new $12 million, $14 million ag center, and all that. I knew I didn't feel right. Went in the doctor. I told him how I was feeling. I couldn't control my temper. I was screaming at night in my sleep. He asked me a few more questions. He said, "You have PTSD." He put me
Post-traumatic stress disorder.
Stress disorder. Generally associated with military. I looked at him and said, "I can't have PTSD. I'm not in the military." He said, "You don't have to be in the military and go to war to get PTSD." And anyway, he gave me a antidepressant. You're the pharmacist, you say it again. Began taking it. Within about 3 weeks, my admin and my support staff person noticed a major change in me. They had been trying to protect me for the last year because they knew I was not right. And they come in my office one day and said, "Your medicine is working. We can tell the difference." I retired about 2 years, 2.5 years after I started taking the medicine. 4 months after retirement, the stress was gone. I was able to wean myself through the doctor, off the medicine, and been fine ever since.
Yeah, so I mean that's a testament right there to how it can work. You know, some people it doesn't just go off of them like that, but you're living proof that it can happen, ma'am.
I'm a veterinarian.
Mm-hmm.
I've had depression, anxiety, as well. I grew out of it, I guess, a little bit. And then in college, I was one of those kids, I was like you. And I'm saying that, all A's, home for more than 2 or 3 nights, freaked out.
Mm-hmm.
I went from living in Medows, Arkansas with just 2,500 people to living at the University of Arkansas in Fayetteville, which, don't know if anybody all know that, but it's not exactly the most wholesome campus.
Yeah.
Fine. Tends to be a lot of drinking and cruising and all sorts of stuff. And freaked out. Had basically a breakdown right there. There was an older student who saw me, came to me, calmed me down. We became best friends. Was doing fine. The second semester, I had full pay scholarships. And full pay scholarships, I was actually getting a little bit of money back. There was a Farm Bureau scholarship that came up. I didn't apply for it because I saw no point applying for it. Well, my mom called me one night and said, you know, did you get your application in? And I said, well, I didn't do it. And she's like, why not? I'm like, well, Mom, everything's paid for. She's like, yeah, but so-and-so and so-and-so. And I don't know what that hell happened, but it tripped me. And I went off the deep end. And it was really bad. I would go cry in the shower. My roommates would have to come get me out of the shower. I had an OCD, it was really bad. I got to where I thought I was avoiding going to class. I was avoiding the one thing. I was like, well, I couldn't leave my room. And then I don't remember who called mom and dad. My dad is here. You ask him about this, he will, I don't know what he'll do. I don't know. I mean, I'm sure he'll say, yeah, it happened. But I called him and said, Dad, we're just trying to get out of this test. You know, he said, get in your truck and you come home now. And I even talked to a psychologist at the school. And basically, what happened on that one was he said, well, just, you know, just don't think about it. Don't just do this. You don't tell somebody not to think about it. What's the first thing you're going to do?
Mm-hmm.
So my dad was about ready to kill him. But he said, have you ever tried to get out of the test in your life? And I said, no. He said, what the hell makes you think you're not doing it? So I came home, I talked to my grad student who was teaching that class, came home, went to my doctor. I hadn't been in there 5 minutes, and he goes, you have OCD? And I was like, okay. He said, so we start chewing that. Because I actually went to my parents and I was bawling. I thought I was going to be put in a mental institution because my brain just wasn't working right. Everything was just muddled up. I couldn't function. And it was like, you know, just boiled down to, tell myself what I do. I knew better than that because I do have a very strong Christian background. I don't get that, you know. But went to him, he put me on meds, Lexapro, which was acetylcholine. And I was on 40 milligrams a day, which is, you know, is a big dose.
Mm-hmm.
I got, you know, okay, went on to med school. And then when I was in med school, as you know, going through pharmacy school and, you know, medical school and all that, it's highly stressful.
Sure.
And you do it again. And when I was on my equine rotation, there were points where you had to go take care of all your animals. And you had to write what we call the SOAP, which
Mm-hmm.
is basically a plan,
Mm-hmm.
you know, TPR, temperature, pulse, respiration, how are they doing, what do they look like, all this other stuff, and write a report every morning before 8 o'clock. And I had 6 mares that I was taking care of, and they're like, well, you only have 6 patients. And I said, no, you make me write a soap on the mare, and you make me write a soap on the foal on her side. So I had 12 patients basically. I was leaving my house at 5 o'clock in the morning, going down to the school, trying to get all that done, do everything it's meds and everything else, and I wouldn't come home until like 11 o'clock at night. And that was a 6-week rotation.
Mm.
And at that point, I got really close.
Mm-hmm.
Really, really close. And had it not been for the counselor, I finally broke down, had a Very, very nice man, but he didn't understand what it was going through. He didn't understand he was pushing us to the breaking point. And when he finally saw it, he backed off. He said, what do I need to do to help? And it was nice that he was willing to do that and didn't say, well, that's it, get over it. But he was able to do that.
Because that's oftentimes that's the culture that we're in. I mean, a lot of times it's served us well, but it's not the way it always should be. It's not the cure-all. It's absolutely not the cure-all. And that's kind of that's why I'm here. Just real quick, I want to talk about, you mentioned these mental health first aid, QPR, both incredible places. You can find both of those on my website. But it's like you say, there are so many tools. You mentioned them yourself. You mentioned meds. You mentioned counseling. There's so many tools that we have at our disposal. And things like QPR and mental health first aid, they're the things that I shouldn't say just anybody can do, but non-mental health care professionals can do. They're much like the mental health, or much like first aid for somebody at a basketball game. It doesn't take a medical doctor to tape an ankle, to ice an elbow. But if that person needs surgery and you can determine that, then they go to the surgeon. Mental health first aid is the same way. Not everybody needs a psychologist. Not everybody needs Dr. Cate right away. But if people more like me, like a pharmacist, or not even just like a pharmacist, like a seed salesman, a vet, nutritionalists, those type of people, if they become trained in mental health first aid, they can funnel the people towards people like Dr. Cate. I wish we could take someone like Dr. Cate and put her in every single small town. I would love that. Missouri is much like Nebraska, and there are only 2 counties, Jackson County and St. Louis County. Jackson County is where Kansas City is, and that are not mental health deserts, mental health care deserts. The rest of the state is. So I want to end here by just kind of talking where you can find the podcast. We release every Monday. You find me on all the podcast mediums, all across social media. Try to stay active on there. And I appreciate you guys. I appreciate you being here today. And I'll leave you with just to say that no matter what you're going through, no matter what issue you have, you matter. Your operation matters. You matter. The most important asset that any farm, ranch, any sort, not just a farm, ranch, but any sort of company can have is the human asset, you. That's the most, because none of it works without that. And I appreciate your time today, and look forward to talking to any of you at any time.
Thank you, Jake. Anybody got any questions or comments? Go ahead.
He was talking about being able to get off the meds. After I got out of school, I actually lost a lot of weight a couple years ago. And I decided, you know what, I've lost 80 pounds, I better come back off my meds. So I backed off from 80 milligrams to 40. I noticed I started getting really edgy, really, and snapping into my head all the time, and I realized it was okay. I backed off too much. So instead of backing off a full 40, I just backed off 20, and I'm steady okay now. And, as the stress goes down, I may be able to back off a little bit more, but like I said, I've been on it for almost 20 years. So, actually over 20 years.
I think an important thing there is self-awareness. I can feel it coming,
Yeah.
and I ebb and tide. So I'm medication free right now, believe it or not. But when I didn't know what was going to happen, every time I walked in the hospital, I almost had a breakdown, and I had to find help. I went and got medication, and I only had it 2 days, and I lost my son. and I went off. But the anxiety is what got me. It's not that I'm not still sad or depressed or anything else, but I can deal with that, right? But I couldn't deal with the anxiety. I'd walk into a hospital and just almost fall completely apart. I couldn't stand still. I was jittery. I couldn't deal with it. So self-awareness, and my wife is very aware. She lines me out like you. John's met my wife, and so has Dr. Cate. She's not afraid to grab me and say, look, that's as a spouse or a friend, or it's all right to do that. And that accountability factor is absolutely huge. But guys, we're running, we're right at 2:30, so you can catch us anytime. Dr. Cate has to get going to be back to one of her daughters participating in the state one act play. So, but I'll be here till you're gone. So visit anytime. Thank you.